Hi, everybody. Welcome to the Tuesday night workshop. And we're going to talk today about kids in chiropractic. And I'm Dr. Kristen Zawada. Welcome. We are going to jump into talking about something we talk about with everybody, but definitely more in the beginning phases of care, and why we get kids adjusted, but why we adjust everybody, but why from starting from birth is so important. And we use a very simple concept. And I love showing this because it's an easy way to also, I feel like, explain this to kids and have them understand what, in a very simplistic way, what it means when we have a subluxation or when our body and brain are not communicating well to each other. And so, give me a second here. We use the understanding and the example or picture of the safety pin. And this is what is, I think, an easy way to see that when the pin is open, if we think about the top of the pin as our brain, and the signal has to come down. See if I can, I don't know if you'll see my mouse because my mouse is white and so is the screen. But the signal needs to come from the brain down through the spinal cord, down through our backbone, down through all the parts and to all the parts and pieces of our body. And it comes out that left side and that right side. And when the signal is closed like this and the safety pin is closed, that signal can come down and get its communication to everywhere it needs to in the body. And then the body processes that, or the organ system or the muscle or whatever we're telling it to do. And then it's got to also have a signal and a loop that goes back up. So it's got to send that signal back up to the brain this way to say, okay, brain, I just did what you asked me to. And now what do you need me to do? And it does this trillions of times a day. It's doing it for every action and, in a sense, reaction that the body and brain experiences and goes through. When we have a subluxation or when we have an interference of that good signal coming from the brain down into our bodies, back up the loop. So maybe it doesn't come all the way down and out properly, or it gets there, but the communication path back up is, if you will, open, like the safety pin, and disconnected, then it doesn't allow that signal that the body got what it needed or did what it needed to do back to the brain. And so that can create a lot of confusion for the brain. And it creates a lot of it to just overwork or be inefficient because it sends either more of a signal or it thinks it has to send a stronger signal, or it doesn't understand that it's what we did and the body just overworks. And so I think it's a simple way to look at how powerful it is that the brain and the body have to communicate, and the way in which they do that, both directions, is through our nervous system, our spinal cord, and the connection of that to all of our parts and pieces. So this is the words we use, but it's that same concept with the picture of body, brain. And the signal that goes out is efferent, and the signal that comes back up is afferent. So I think that's a good way for all ages to understand how the signals go, where they've got to come from, where they have to go to, and then all the processing that happens in between. That signal needs to be as clear as possible. So I think sometimes we can just make it complicated and it doesn't need to be complicated. The things that I may talk through, we may not have slides for, but there's lots of things that affect kids and why we would adjust. And I think some of the biggest things is our immune system, right? So for all of us, but especially kids, when they're at birth, they're and born, and in those first handful of months to years of life, their immune system isn't fully developed, and they're getting a lot of that strength in their immune system and that building up of understanding what's all out there as far as just everything, right? That's on this side of the womb, and when they come out of that enclosed area of just being exposed to what's in mom's belly and what she's being exposed to being exposed to a lot of different things. And so when that nervous system and that, I guess I'd say immune system part of the nervous system isn't fully developed, that's when we want to give them all the help they can in developing that to support that. So, I'm going to read you some things and some different statistics that were done out of Princeton on chiropractic and the immune system. that has lots of peer-reviewed and published studies and a list that I have. I don't have it in here because I didn't want to bore you with a bunch of text necessarily. That's something you can ask us for and we can send you. But it's talking about how, the purpose of the adjustment is really that we're improving the communication in that nervous system, like we were just talking about, so the body can react more efficiently and effectively to its surroundings. Poor movement in the spine then has been, has an adverse effect on the nervous system and thereby can affect your immune response. So the body's immune response is impacted, and then again has to work harder to get the signal or harder to understand what to do or to have the part of our immune system that we kind of call our defense system is our killer T cells, and those are parts of our white blood cells. And so the body needs time to develop those. And some of that comes from a lot of the good immunity that babies get from the colostrum and the early phases and days of breastfeeding with mom. So it's really important that they get that, so that they start off on the right path. And I don't know why you're seeing that. Are you guys seeing that? Hang on a second. I don't know why that's staying up on the screen, but it is. So anyway, that the one way that happens when there's interference or that adverse effect on the immune system via the nervous system is that the body kind of incorrectly activates a stress response. And so that slowly then creates the immune system to react. And so when we take away that dysfunction or that improper reaction, if you will, almost to fight something in our body that it doesn't need to, then the adjustments help in improving that nervous system function. It takes away that immune function. So it's taking away that stress that sometimes makes the body work too hard, makes the immune system work too hard, or overwork. Some of the studies that have been done with chiropractic in the immune system also talk about the measuring effects of the adjustments on the immune system by those T and B lymphocyte counts. So that's also those are those natural killer cell numbers in our body. It affects the antibody levels. It affects some of the activity in plasma of the beta endorphin cells and levels. One of the measurements that was in one of the studies that I pulled talks about the effects of chiropractic adjustments on the patients, even with a cell immunity issue like HIV. And it talks about how those CD4 cells, which are those killer helper cells of the immune system, they get attacked by someone who has like an autoimmune disease or something like HIV. So this was in older groups, but the body works the same in all of us that way. So when those centers have been measured by these patients through medical groups and measured the amount of blood work in those types of groups of patients, both the control and the placebo group received adjustments, and each received about an 8% decrease in the not good cells, if you will, in a 6-month period. Group of the two groups receiving chiropractic adjustments and not the placebo component of it showed an experience a 48% increase of those CD4 cells. So those killer T cells over a 6-month period. So again, immunity and adjustments and kids' health is so imperative. So I think so many times people think about why we adjust or why an adult comes to see us is because of pain or headaches and migraines or low back pain or a disc injury or a sports injury or a concussion. But it really works with setting the immune system up, the nervous system up to be strong, to be stable, to be adaptable, right? To be able to understand these different things coming in and out of it as good as well as possible. So that when it does have, say, something more physically traumatic happen or something emotional happen, like as a child experiences puberty, as they go through the growing pains of being in school and just being that age, right? Making friends, being changes, figuring out who they are, like all those developmental things, there's got to be a stability there too. And so when the brain can do what it's supposed to do, and it has that stability, there's just a chemistry of the brain and the body that's better, right? So when the nervous system's functioning and supporting everything, So that's just not the immune system, but your cardiovascular system, your respiratory system, the endocrine system, so all the chemicals of the body, our hormonal system. All of that has just more support to it when it has to go through all those ebbs and flows and ups and downs and changes that you probably couldn't pay many of us to go back to as far as puberty and all of that time frame. I know I would not go back to those days. So it just gives them more support to get through those processes, let alone any other traumas or physical things that happen in their lifetime. So there's a couple other studies. There's a couple other really cool things talking about cellular damage and genetic mutations and all the kinds of things we're learning in epigenetics. But to go back to kids, I love this diagram because it kind of talks through, especially for an early parent or a first-time parent. I love handing this out, and it's got most of the things you can see on the slides there. But we talk about what we were just alluding to, right? There's an emotional component to subluxation, there's a physical component to subluxation, and there's a chemical stressor or component. And so let me grab my other diagram that I can read a little easier. That one. And one that maybe isn't laminated, so I don't have the glare. Okay. So there's different phases and factors that, play a role in why we adjust kids, why we would check an infant, and that process through birth and delivery and just what was going on in the womb, and then what happens when they come out. So when we're talking about playing a role in their care, we're talking about all the things that they have to do, right? So milestone checkups are super important. There's things that we want to make sure they're reaching and hitting at an early phase, way before school age, way before a lot of exposure even to a lot of other things. But so when we, touched on, it's important mom and dad are healthy. It's important that chemical interventions during pregnancy, if there's hormonal support or pharmaceuticals or anything else, pain relievers, the processed foods, like all that affects the baby when that's what mom's eating or when that's what mom's exposed to. So a reason to check a child. Physical, they're stressed during the pregnancy. So they are receiving an impulse into them when mom gets ultrasounds to look at them. And other components like things we may think about, like accidents that could take place, whether it's something like being in a vehicle accident or something like kids falling off of bikes, falling off of beds and dressers when they're still, crawling phase or not even crawling phase. Those are all stresses that puts upon the physical part of their system. Emotionally, again, the stress of pregnancy, there can be, changes with, again, the chemistry, doing a different process, getting pregnant, having any other types of stressors there that are emotional stressors, puts stress into the system. And interventions is one we talk about, I feel like, the most because we see that and we know what's happened there and it's more of a tangible thing. But it's really like, was the baby, born breech? Was the baby born cesarean? Were they born vaginally? Did they use the forceps or a vacuum, to extract the baby? Or was it a smooth delivery? What kind of forces were put upon their bodies, their heads, their nervous systems, their brain, their skulls, and their spines that have not developed yet and fully formed yet? They have no muscles to control amount of movement. And many babies' heads, get turned a good 180 degrees in order to get the shoulders out and come out. So there's lots of stress on the nervous system in that first day of life that is worth making sure doesn't stay in their system and that we check for. So other chemical stressors that I think parents should be aware of are things that would be, are they getting breast milk? What type of milk are they getting? If there's a formula that a mom is using, what are they using? There is different things like how we can support them. And all of us is taking chemicals out of what we clean our houses with, what we bathe in. So the products that, as chemical free as possible. When you think about kids are going to be touching the floors, crawling on the floors, so anything that they touch or anything that you're putting all over their skin, which is their biggest organ, right, is going to absorb into their system. How we're treating, whether we're giving them fever reducers or pain relievers when they have aches and pains or when they, spike a fever. Those are all natural processes of a healthy child and of a healthy immune system. So we just have to understand and explain to parents those parameters so that the health is monitored, but that there's nothing wrong with a fever. That's the body's way of killing the virus and bacteria that's within the body that's creating the problem. So we really don't want to suppress it. So thinking about kids in chiropractic, it's when we introduce those things early on, again, their immune system gets stronger with a healthier nervous system and through the adjustment and through all these healthier options and things that we can be doing. So it's less chance that their bodies and their systems can't tolerate what it's bombarded with. There is a component physically, we kind of talked about that. I think what we tend to see is if kids are in bad carriers, if they're left in carriers or car seats too long or swings or certain chairs, there's the curves of the spine that you guys, if you're patients, about that you are developing them as you go through these milestone phases that are on this chart. So birth, as the baby starts to get into that phase of holding their head up, that is helping develop some of that neck curve. So they need that tummy time, and they need that in that second picture when they're raising their head and they're starting to use that upper body strength. It's developing within the first few months, and those neck muscles get stronger to hold the head up. If the baby can't do that properly, or it carries its head one side versus the other, that's something to note. That's a problem in usually their structural system or in their nervous system that's creating torque or tension that shouldn't be there. So that's what we work on removing, so that they do all these milestones really well, really smoothly, and really seamlessly for everybody. And then once they get past that phase and they get into being able to, it's very, key to then roll over next to that and sit. But as you get to the crawling phase and cruising phase, this is really important, because this is where that second curve, which in your low back is the same direction as your neck, right? That C-shaped curve we talk about, those curves develop as they get some weight on them, as they get some muscle development in their upper body and their neck from holding their head up and doing tummy time. Now they're developing that lower cross crawl pattern, and that lumbar lordosis, or that low back curve, is developing now between that 6 and 12-month period, with that what we kind of call cross crawl or cruising. They need, and it's vital that they do this. So if babies aren't crawling or doing enough of this, kind of cruising, or we're trying to be, in my opinion, the just kind of overachievers of wanting a kid to walk sooner, you are not doing them a service. They need time to figure out how to do this motion. When they get when they start to put that heavier, like that weight on, this is like when they get those little Buddha bellies and they drop those bellies towards the floor as they're crawling, they're developing that little curve in their low back. And so we need those curves for them and that time for those muscles and that nervous system to develop those patterns, so that then they walk better, they walk well, they have more stability, and then they have stability in just the right places for their spine to develop that opposite curve in their mid back. So those are all the structural components that kind of come along with that first year of milestones, and why that's so important that someone's watching that they're checking that. And that it's going at the pace it should, and we're not forcing it. And if they're not doing that, there's a reason. It doesn't always, it's in pain. Like the kid doesn't scream at us and necessarily tell us, Mom, this hurts here, or this doesn't feel right to move. They just find a way around it, right? So they just move differently and choose a different way to do something, like scoot on a hip or tuck a leg under them and just figure out a different way to get across the room because they want to get there. But it's a component of, are they doing it the right way? So we're catching those things as we're adjusting, and I don't know why my screen, there we go, isn't going to the next slide. So there's multiple things that we're watching through those eras of that first year, and why it's so important that those things are being checked so that they happen in a natural way and they happen very fluidly, and there's not a lot of stress on the system. There's, besides, I would say, if I had to give like a top 10, then it's really that, again, there's lots of research to show how the brain and the nervous system development is supported by that good neural plasticity, which is what's happening when the body and the brain are getting a better connection. every time those first 3 years, they're like sponges and they're just taking on trillions of pieces of data and information to build a system that's healthy and to build an understanding of how to be efficient, but also just to have that depth to their systems. So to strengthen the child's immunity, really also is just a benefit to everybody, right? I mean, less fevers, less colds, less earaches, less illnesses, less time that your baby's uncomfortable, that you're not happy and comfortable, less sleepless nights, all those types of things that can be just hard on everybody in the house, not just the babe. A lot of it with adjusting helps resolve the things we see with breastfeeding when it's a challenge, with colic when it's a challenge. There's all reasons that that's happening in their digestive system when it's not fully developed either, and encourages really kids to thrive that way because it gives them more digestive support when their immune system, because as you guys know, because of other workshops, 60 to 70% of your immune system is in your gut. So when the gut's not fully developed, if they're not getting good things going in, or their body can't process it, or their bacterial, like the good bacteria levels in their system are off, depending on how they came into this world or things they were exposed to, then we have to give them support for that and help build that up so that that process of digestion of all things is good, so that they can start taking on, mushy things and then solids and all of that. We really see a big behavioral shift and a big change in kids that get adjusted with concentration. And again, it's just supporting the nervous system, and the part of the nervous system that's the most impactful to that is that ability to concentrate and focus. And that comes from the work that happens right at the head and the neck. So I like kind of bridging into this slide because yes, it's promoting body balance and better posture, and it helps with things like allergies and asthma and bedwetting because it's working on the systems that support that not becoming an inflammation or an issue for them, gives them more immunity, and able to fight things that they're exposed to. But this is really good things that we see with kiddos as they get into this little bit of, I'd say, preschool and elementary age, is, the benefits of all the things we just said. What's cool is that, seeing this list maybe helps jog why someone would get checked. So, many of those things are repeated on this slide, but we see improved behavior and mood and connection with their siblings and their friends and their parents. They have a different kind of perception of their environment. So a lot of this stuff it's not about pain for them, it's about function and connection. And they're doing a ton of that when they're little. And if that doesn't happen then, that it certainly doesn't happen when they're adults. So it's setting the stage for them just to be more fruitful in life and in all the other things that they will be, in a sense, maybe bombarded with just the way our world is these days. So, initially we see things that it helps relieve with colic and reflux and constipation and digestive things. And then, their systems functioning better, like respiratory, like eyes, ears, nose, throat. But then we really see it with, less anxiety or processing disorders if we can tackle that early, if things are coming on earlier than, us seeing them late school age. As well as seeing benefits of, better posture. We go through a whole slide and a whole workshop talking about backpack ergonomics and what should their backpack look like and what size should it be and how big should it be on them. So if you didn't get to see that one and you have a kiddo approaching, school age or is in school age carrying their backpack, go back and look at the workshop that talks through why it's so important that we support them in the right way and buy them the right things that they'll use and use correctly. That's, again, all structural. And what we see is the downside when some of these things don't happen and what starts to spiral for families and for kids is sort of synapsed on this slide, that we can have traumas that happen from, the ways a birth went down or a fall or an accident or stressful pregnancy, to the toxicity that is around in our environment or around in people's homes or food. That is taken in, and then just if there's a stressful environment, an unsafe environment, or just a lifestyle that is a lot of overload. For example, letting kids watch a lot of screen time, you're going to start to see warning signs that show up that can become a spiral effect because their nervous systems are not at a place to adapt to that and handle that kind of overload that us as maybe adults are just kind of used to in some degrees and can tolerate to a certain level. Their systems cannot. So it's really important if we don't want to see chronic illnesses and things start to show up behaviorally that we look at these kind of early warning signs and say, hey, what can we do to support their system being more elastic, right? The plasticity be there, give them strength, give them ability to process, give them support in their not just physical functions, but their ability to process other chemical, emotional things that happen in our world. And we will see a lot less of these delays, if you will, happening or setbacks, whether it's in health, like being sick or having a weak immune system and getting every cold or flu or whatnot that goes by, or from the perspective of like speech and connection with, being able to communicate with someone, being able to make friends, being able to kind of thrive in that age of development. So those are the kind of the things we wanted to hit on. There is a bazillion things we could talk about and tons of research with kids. I guess I would say if you know of kiddos that haven't been checked, please let them know we are here to support them and to just do exams that we do that are very different on kids to check and see if their bodies are processing and thriving in ways that they wouldn't necessarily be able to explain. So it's really good to just have a good idea where your kiddo's at so that we can watch these benchmarks and mile markers and hopefully allow them to do them as smooth as possible. And if it's a child that you feel you're seeing challenges in areas and not sure how to help with it, it may just be a processing component too, that there's nothing wrong with their ability to do something. Their brain just can't process it the same way that somebody else's or ours does. And so it's just about reconnecting those dots for them. It's not that they can't do it. It's just that their brain is doing it possibly in a scrambled order. And so it's easy to do some simple tests to assess that in a younger child or even grade school especially, and help them process better so that they can come out of that phase and then just be able to do things in a much more thriving way. So we appreciate you being on with us tonight and talking about kids in chiropractic and why it's so vital for them to receive this care early in life to set them up for a very successful growth phase in all age groups, I feel like. So if you have questions, let us know. If there's someone you'd like us to reach out to and share information with or share research with, let us know. It's out there. We have it. And let them come on in and experience what our family's like here at Monarch. So thanks for joining us on Tuesday night. We will see you next Tuesday. Have a blessed evening and we'll see you in the office. Please let us know your takeaways and come over to the education station and share with us what you got most out of this that you didn't know before. Talk to you soon.